techniques and sequence of adult CPR. Always make sure the scene is safe for you and the victim. Check for response by tapping the victim's shoulder and shout, "Are you okay?" If there is no response, that is, if the victim is unresponsive and not breathing, or only gasping, activate emergency medical services and get or call for an AED. Immediately start the chest compressions. Push hard and fast at a rate of at least 100 compressions per minute. Count out loud, 1, 2, 3, 4, 5, up to 30 compressions. Push the chest at least 2 inches deep with each compression. After 30 compressions, open the airway using the head tilt chin lift method. Then give 2 mouth-to-mouth breaths. Deliver air over 1 second to make the victim's chest rise. Give 1 breath every 5 to 6 seconds for a rate of 10 to 12 breaths per minute. Continue 30 compressions followed by 2 ventilations for a ratio of 30 to 2. The AED should be used as soon as it is available. Resume chest compressions immediately after the shock is given. For adult CPR, the ratio of compression to ventilation is 30 to 2 for both 1 and 2 rescuers. For 2 rescuers, change the compressor every 2 minutes or every 5 cycles to avoid fatigue. Rescuers should try to change the compressor roll in less than 5 seconds.
How to perform hands-only CPR. Cardiac emergencies can happen anywhere. Be prepared with a simple technique known as hands-only CPR. You can learn it in minutes, it's easy to remember, and it can help save a life. You will need the willingness to act and a few simple skills. Whenever possible, use disposable gloves when providing emergency care. Step 1. If you see someone suddenly collapse, check the scene for safety and then see if the person responds to you by tapping them on the shoulder and shouting, "Are you okay?" Step 2. Briefly look for breathing. Step 3. If they don't respond, call or send someone to call 911 or the local emergency number right away. Step 4. If the person is not breathing or is gasping, prepare to give chest compressions. Kneel beside them and put the heel of one hand on the center of their chest. Place your other hand over that hand, lacing your fingers together. Position your shoulders directly over your hands, keeping your arms straight and your fingers off the chest. Step 5. Push hard and fast, at least 2 inches, then let the chest rise completely before pressing down again. Don't take your hands off the chest, just your weight. Step 6. Keep going. Do not stop compressions until the person shows an obvious sign of life like breathing, the scene becomes unsafe, an automated external defibrillator or AED is ready, you're too exhausted to continue, or a trained responder takes over. Step 7. Get training and encourage others to do so by taking an American Red Cross health and safety course. Knowing full CPR, chest compressions, and breaths will enable you to help in other emergencies such as drowning and choking. Every household should have at least one person trained in life-saving skills. Did you know? Most people who survive a cardiac emergency are helped by a bystander. To find your local Red Cross chapter, visit redcross.org.
Every year, thousands of people die of sudden cardiac arrest.
She's unconscious. Go to the front desk, call 911, and bring me the AED.
Following the links of the cardiac chain of survival can help save lives. The sooner 911 is called, the sooner advanced medical care will arrive. Early CPR helps circulate blood that contains oxygen to vital organs. Most people experiencing sudden cardiac arrest need an electrical shock called defibrillation. Continue CPR until an AED is ready to use.
Got the AED.
14, 15.
An AED, or Automated External Defibrillator, is a portable electronic device that analyzes the heart's rhythm and determines if an electrical shock is needed to help the heart restore an effective rhythm. Most AEDs can be operated by following these general instructions. Turn on the AED. The AED will tell you what to do next.
Press pads firmly to patient's bare skin.
Make sure the person's chest is bare and dry. Use a cloth or gauze pad to dry the person's bare skin where the pads will be placed. Remove the pads from their packaging. Carefully peel off the backing from one pad and place the pad on the upper right chest. Place the other pad on the left side of the chest. Plug in the connector to the AED if necessary. The AED should start analyzing the person's heart rhythm.
Analyzing heart rhythm. Do not touch patient.
Analyzing.
Do not allow yourself or anyone else to touch the person while the AED is analyzing.
They're in shock. Move away from the patient.
Make sure that no one, including you, is touching the person.
Press red flashing button to deliver shock. Shock delivered. It is now safe to touch the patient. Start CPR.
After a shock is delivered, or if no shock is advised, give about 2 minutes or 5 cycles of CPR. When 2 minutes have passed, the AED should automatically begin to reanalyze the heart rhythm and will advise you with a prompt to stay clear of the person.
Do not touch patient. Analyzing heart rhythm.
Continue to follow the prompts of the AED and provide care as needed.
It is now safe to touch the patient. Start CPR.
If at any time you notice an obvious sign of life, such as breathing, stop CPR, maintain an open airway, and monitor for any changes in condition. An AED can also be used for children and infants who are not breathing. Use pediatric pads if they are available. Operate the AED and apply the pediatric pads to the child's chest the same way you would for an adult.
Do not touch patient. Analyzing heart rhythm.
Analyzing. Everyone stand clear.
For a small child or infant, the pediatric pads may be too large to fit on the chest without touching each other. You may need to attach one pad on the center of the chest and the other on the back between the shoulder blades. Here is how you would work with a second trained responder when using an AED. One responder continues CPR while the other prepares the AED. This is another example of how CPR and an AED work together as links in the cardiac chain of survival. One responder continues CPR while the other attaches the AED pads and operates the AED.
Do not touch patient. Analyzing heart rhythm.
Everyone stand clear.
Preparing shock. Move away from the patient.
Shock advised. Everyone stand clear.
Press red flashing button to deliver shock. Shock delivered. It is now safe to touch the patient. Start CPR.
This short video will highlight the HeartSign Samaritan PAD or Public Access Defibrillator. To set up, simply install a pad pack as shown. The pad pack contains both the system battery and patient electrode pads. The adult pad pack is for patients over 8 years old and over 55 pounds or 25 kilos. The pediatric pack is for patients from 1 to 8 years old and under 55 pounds or 25 kilos in weight. The Samaritan PAD unit must carry this label in order to accept a pediatric pack. When powered on, the unit announces the patient type, either adult or child, depending on which pack is installed.
Child patient. Adult patient.
Insertion of any pad pack causes a green light to blink, indicating a fully functional system. After recognizing the appropriate patient pad pack, the system provides the following rescue prompts.
Call for medical assistance. Remove clothing from patient's chest to expose bare skin. Pull green tab to remove pads.
Electrode placement is clearly illustrated on each pad. Child electrodes are designed for front-back positioning as shown.
Peel pads from liner. Apply pads to patient's bare chest as shown in picture. Press pads firmly to patient's bare skin. Assessing heart rhythm. Do not touch the patient. Stand clear of patient. Shock advised. Stand clear of patient. Press the shock button now. Shock delivered. It is safe to touch the patient. Begin CPR. No shock advised. It is safe to touch the patient. Begin CPR.
If you find someone who appears to be unconscious, is not showing any signs of responsiveness, and is not breathing, remain calm.
Wayne, are you okay? Can you open your eyes if you can hear?
Call for help, retrieve the AED, and begin CPR. Remove the AED from its carry case, switch it on, and follow the voice prompts and instructions.
Adult patient, call for medical assistance. Remove clothing from patient's chest to expose bare skin. Pull green tab to remove pads. Peel pads from liner. Apply pads to patient's bare chest, as shown in picture. Press pads firmly to patient's bare skin.
Shave hair from the patient's chest if necessary. Ensure that it is dry and all undergarments have been removed.
Assessing heart rhythm. Do not touch the patient. Analyzing. Do not touch the patient. Analyzing. No shock advised. Begin CPR.
The Samaritan 500P will analyze the effectiveness of the CPR and will instruct the rescuer whether to push harder, push faster, or push slower, based on real-time feedback.
It is safe to touch the patient. Place overlapping hands in middle of chest. Press directly down on the chest in time with metronome. Remain calm.
When performing CPR, watch and listen to the AED.
Push harder.
It will analyze the effectiveness of the compressions.
Good compressions. Push faster.
It gives feedback on the speed and depth of the compressions. These real-time prompts, based on actual blood flow through the heart, ensure you are performing effective CPR.
Stop CPR. Assessing heart rhythm. Do not touch the patient. Analyzing. Do not touch the patient. Stand clear of patient. Shock advised. Press the orange shock button now. Shock delivered.
The Samaritan 500P will only shock the victim if it determines that a shock is required, so there is absolutely no possibility of accidentally delivering a shock.
Begin CPR. It is safe to touch the patient.
Continue CPR until further instruction or until the emergency services arrive.
Good compressions.
Perform rescue breaths as appropriate and in accordance with your training. After using the AED, the pad pack must be replaced with a new one. Then return the AED to its original position. If you have the optional data management package, you can download the recorded event using a cable and the Saver Evo software. The Samaritan 500P. More than an AED. It's life-saving. Pure and simple.